All right, today we're diving into a really intense topic. We're going to talk about a condition where one of your body's most important organs basically turns on itself. I'm talking about pancreatitis, a super painful and honestly a pretty devastating inflammation. So let's break down what actually happens when this critical internal factory starts to go haywire.
Seriously, think about that for a second. An organ digesting itself? It sounds like something straight out of a sci fi horror movie, right? But believe it or not, this is the core of what happens in pancreatitis. It's this dramatic, dangerous process where the very thing that's supposed to break down your food, well, it turns against the organ that made it.
So, to really get a handle on this, we've got to look at the battlefield. And in this case, the pancreas is totally under siege. But here's the crazy part. The attack isn't coming from some virus or bacteria from the outside. No, this is an inside job. The pancreas is being attacked by its own powerful weapons. Okay, so what is pancreatitis, really? At its core, it's just inflammation of the pancreas. But that's a huge deal because this small but seriously mighty organ, kind of tucked away behind the stomach, has two gigantic jobs. First, it makes the enzymes that break down all the food you eat. And second, it produces hormones. You've definitely heard of one of them, insulin, to manage your blood sugar. So you can imagine when it gets inflamed, both of those absolutely critical systems just get thrown into total chaos. Now, it's super important to know that pancreatitis isn't just one single thing. It really comes in two main flavors. You've got acute pancreatitis, which is this sudden, really intense, fiery attack that thankfully can often be reversed. And then there's chronic pancreatitis. This one's more of a long, smoldering problem that causes permanent, irreversible damage over time. We're going to kick things off by looking at that sudden assault first. All right, so what in the world triggers this sudden aggressive attack? Well, to remember the main culprits, doctors and nurses actually have this really clever mnemonic, and it perfectly sets the stage for our investigation. And that mnemonic is get smashed. It's a bit intense, I know, but it covers pretty much all the main causes. Let's zoom in on the two biggest offenders, though. First up, G is for gallstones. This is the number one cause. Basically, a little stone can pop out of the gallbladder and physically block the pipe the pancreas uses to get its enzymes out. This causes a really dangerous backup. Then we have E for ethanol. Yep, that's alcohol. Heavy drinking is just flat out toxic to the cells in the pancreas. It triggers inflammation and messes up how they work. Now, sure, there are other wild causes on this list, like trauma, certain drugs, even a scorpion sting of all things. But gallstones and alcohol, they're responsible for the vast majority of cases, by far. So how exactly does a gallstone or a bunch of alcohol actually trigger this self-destruction? Okay, this is where it gets really fascinating. Here's the chain reaction. Normally, your pancreas makes these powerful digestive enzymes in a safe mode. They're not supposed to switch on until they're safely inside your small intestine. But with acute pancreatitis, they get activated way too early while they're still inside the pancreas. And the result is exactly what we talked about, autodigestion. The organ literally starts digesting itself from the inside out. And that leads to massive inflammation and even tissue death. When doctors are looking for this, there are some classic clues. The absolute hallmark symptom is this severe, deep pain in the upper abdomen that feels like it's boring straight through to your back. It's so intense that people often say the only thing that helps, even a little, is leaning forward, because it just takes a bit of pressure off that inflamed pancreas. And in really bad cases, you can even see these telltale signs on the skin. Bruising on the sides of the abdomen or around the belly button. That's a sign of internal bleeding caused by those destructive enzymes leaking out and damaging nearby tissues. Okay, so with all these clues pointing in one direction, it's time to officially crack the case. And you have to understand, diagnosing and treating acute pancreatitis is an absolute race against the clock. The goal is to calm down that inflammation as fast as possible and stop it from causing damage all over the body. And actually, making the diagnosis is pretty methodical. It's a checklist, really. A doctor needs to confirm just two out of these three things. Number one, does the patient's story match that classic abdominal pain we just talked about? Number two, does their blood work show sky-high levels of pancreatic enzymes? And number three, do the pictures, from a CT scan or ultrasound, actually show an inflamed pancreas? Get a yes on any two of those three, and that's the diagnosis. So let's look at that investigator's toolkit a little closer. First, you got the blood tests. These look for enzymes called amylase and lipase, and high levels are basically the chemical proof that the pancreas is injured. Then you have the imaging, which acts like a surveillance camera. They'll usually start with an ultrasound. That's the best way to spot the number one suspect: gallstones. If they need a better look, a CT scan gives a much more detailed picture of just how bad the inflammation is and if there are any immediate complications. And hey, a quick but important note on those blood tests. When it comes to the evidence, lipase is really the star witness. See, both amylase and lipase levels will go up, but lipase is much more specific to the pancreas. Plus, it stays elevated for longer. All that makes it the most reliable blood marker we have for confirming acute pancreatitis.
Okay, diagnosis is confirmed. Now what? The treatment has to be fast, and it's all about support. The very first thing is to put the pancreas on complete rest, and that means absolutely nothing to eat or drink. Why? Because any food at all would tell the pancreas, hey, time to make more enzymes, which are the very things causing all the damage. Next, it's all about aggressive IV fluids. This is so crucial for supporting blood pressure and protecting the kidneys. Of course, managing that intense pain is a top priority. And then finally, you've got to deal with whatever caused it in the first place, like going in to remove that gallstone that's blocking things up.
And there's a good reason for all this urgency. The complications can be incredibly severe. You have local problems right at the pancreas itself. Parts of the organ can actually die, or these painful fluid-filled sacs called pseudocysts can form. But what's even more dangerous is when the inflammation goes systemic, when it causes this body-wide inflammatory storm. That can lead to shock, kidney failure, and even a really bad lung injury called ARDS, where the lungs basically fill up with fluid, making it almost impossible to breathe. So we've seen the sudden, violent assault of acute pancreatitis. Now let's switch gears and talk about its counterpart, chronic pancreatitis. And this isn't a single battle. This is a long, smoldering war that just slowly grinds the organ down year after year. And when you look at the causes of the chronic form, while there are a few, one cause stands head and shoulders above the rest: long-term heavy alcohol use. It's just a brutal cycle. The repeated exposure to alcohol keeps triggering these rounds of inflammation that over time lead to permanent scarring and damage. It literally changes the entire structure and function of the organ for good. The signs of chronic pancreatitis really tell the story of an organ that's just failing. It's failing at both of its big jobs. You still get that awful pain, which can be constant or come and go, but the really key signs are about malfunction. Job 1, digestion, is shot. Without enough enzymes, the body can't absorb fat from food. This leads to weight loss and, well, to be blunt, greasy, foul-smelling stools. And then job 2, hormones, starts to fail. As the insulin-making cells are destroyed, patients develop diabetes. The whole system is breaking down. So how do you manage this long term? It really boils down to two things: replacing the function that's been lost and preventing any more damage. To replace the lost function, patients literally have to take pills containing pancreatic enzymes with every single meal, just so they can digest their food. They need ongoing pain management and insulin if they've developed diabetes. But the absolute 100% non-negotiable cornerstone of treatment? They have to stop all alcohol and smoking, period. It's the only way to try and stop the disease from getting worse. And that really brings us full circle to one last crucial question. We've seen how pancreatitis can be this sudden, one-time attack, something that's often reversible and triggered by, say, a random gallstone. And we've also seen how it can be this slow, progressive, lifelong disease, most often driven by lifestyle choices like alcohol use. This powerful contrast really leaves you with a critical thought, doesn't it? When you look at your own health, what are the key risk factors that are truly within your power to control?